For more than 20 years, CTV has captured the moments that matter in our community. From our studios in St. Clair, you're watching Focus with Paul Dingeman.
Well, Merry Christmas and Happy New Year. Nice to see you. I hope your holidays are going good. We've got a friend by the name of Deb Johnson is here with us today to talk about all the things good, bad, and indifferent that happened during the holidays. Deb, well, welcome.
Thank you for having me. Happy to be here.
Nice to see you.
Always good to see you.
You brought along a little bit of good cheer.
Yeah.
It's awfully nice of you to do that. We'll sample that later.
It's like a cake thing.
It's a tough time of year for so many people. It's the time of year when we get the blues. A lot of people are alone. Families are out of town, or they don't have families. Mm-hmm. People get depressed, don't they?
They do, and we don't call it, like, typically it's not clinical depression if it's like short-lived. If it's brought on by the holidays, it's more like the holiday blues, which will go away probably once the holidays pass. And seasonal factors such as getting less sunlight, changes, and that happened at this time. That happens like right before the holidays, so we're adjusting to that still, and then think everything with the holidays. Whether it's your first holiday that you're having with the loss, where you lost a loved one in your family.
Right.
Maybe you just got divorced. Maybe you're having financial troubles. Maybe you lost your job. Maybe there's serious illness in the family. Any of those kinds of things will cause the blues, and it makes it harder at the holidays, because the holidays people think about, that's the time everything should be happy and wonderful, and like my favorite Hallmark movies, because everything's perfect on those. It's happy ending. Everybody gets along. It's awesome. That's not reality. I like watching it just because it's fun, and you like kind of drift off and lose yourself in that for a little bit. But it's not. That's not reality. Most families have something going on in their family that makes it sometimes not as easy, or it's something you just have to, you push through the holidays, and you still try to think about all the good things that you still do have, because maybe there's one family member that's out, but you got a bunch of family members that are there and want to be there, and think about how you're blessed that way, or you're with your health, or whatever good things you have going on in your life. Because even I was talking with one of our psychiatrists about this yesterday, but even when there's things that are going wrong, if you really take a minute and think about it, you can find a lot of things that are right.
Yes, absolutely.
And try to think about that. But so that's the blues versus depression. If you have real clinical depression, you're not going to be able to just go, okay, I could be worse, so I'm going to snap out of this. That's not going to happen. So you really do. If you have depression, so that's the feelings linger for a period of time. You can't snap out of it. Maybe you're sleeping more, you're sleeping less, you're not eating, or you're eating too much. You're drinking too much, different kinds of things like that, then you should call and ask, if you call our access line, 888-225-4447, you can ask, we can do an assessment and get a person in for services, or make a referral out to the community. If you're not sure if you need treatment, give us a call, talk about it, and we can help people sort that out.
And we live in an area, unfortunately, where we get a lot of clouds, and clouds don't make you happy either.
No.
Those are the people that live in Florida or out in California. They see a lot of sun, which helps that depression, which helps you put a little smile.
That vitamin D is
You can get
great.
outside and walk and do things along those lines. Weather's been pretty good to us outside of some wind, but we haven't had any snow yet, and so there are positive things in snow. But we live in a unique area, and the help is always just around the corner.
And people, you bring up a great point about the sunlight. So physical exercise helps tremendously. I say that's sort of the answer to a lot of things. All through COVID, we were talking about what can you do to help get through it. Take a walk, take a run, take a jog, whatever. But especially when it's sunny outside.
Yeah.
I mean, it's just, you feel happier. It's just, and the walking, the physical exercise releases endorphins to your brain, and that makes you feel happier.
Right.
So those are things that it's important to do that. Like, if you can start your day off like that, it's great. Or if you can't start your day, if you finish your day, it's probably gonna be in the dark with no sunlight, because by the time I get home, it's dark these days.
Right.
But you know, maybe an afternoon walk at lunchtime or something. But yeah, physical exercise is great. So
Okay.
people should do that.
All right. So we've talked about depression, and we're going to put depression on the side of the thing and talk about some other things. One of them is vaccinations. At the beginning of December was influenza flu vaccination week. So we've missed the actual week, but you still get your flu shot. You can still
That's
get
right.
your COVID shot.
And they're still encouraging people to get flu shots and COVID vaccines, of course. So even if you missed December 5th through the 11th, the National Influenza Week, you can get it anytime. In fact, I just got my flu shot a couple days ago. I got it earlier this week, Monday, because we can get them from our pharmacy. Most pharmacies you can get them. Just don't make a little quick appointment online or whatever. And then they're all giving out free COVID vaccines as well. And as you have, anybody who's watching the news are watching the COVID rates rise rapidly with the newest variant, Omicron. All those names, we think they're all.
It's COVID, you know.
Yeah, it's COVID.
Get a shot and get it over with.
And and so we're really hoping that people will consider the vaccine. But even if you don't, if you're against the vaccine, that's your business. But I hope that you will make it your business to then quarantine if you have a close contact with somebody who has COVID, and wear masks out in public. So that you don't transmit COVID to other people, because it definitely is on the rise, and we'd like to try to slow it down again.
Yeah, it affects so many things. The schools, work, factories. It's amazing how many little tentacles this little disease has.
Yeah, and especially the whole school situation. I was thinking I talked about it here, but maybe I didn't, because I haven't been here since the Oxford situation.
Right. No, you haven't.
But so kids have been dealing with COVID and all the disruptions in their lives because of that, and now the Oxford shooting, and then now multiple other schools. There's threats in all these schools, like the copycat crime kind of a phenomenon, which I don't understand it, because you're going to be in trouble. All those kind of threats are taken so seriously, but obviously kids' mental health is what's the word I want to say? It's
critical.
And it's kind of in a, it's in a not a great state right now, because it already wasn't, probably because of COVID, and now we have other things going on. And I mean, how scary for the kids in school. They should be able to go to school and have fun and not have to worry about somebody having a gun. And so there's just a lot of things that that we hope that people will think about. If we could at least get rid of COVID, that might help a little bit. But anyways, I was going to say, and we do have a lot of in St. Clair County, we have mental health supports in several of our schools, just on a regular basis. So that's there.
They're talking about adding more counselors and more social workers to the schools. You're an employer of counselors and social workers. Where are they going to find them?
That is a good question, Paul. So that would be anybody thinking about college right now or in college. That would be Masters in Social Work would be my recommendation. You will get hired immediately when you get out of school. But that is the tricky thing of finding them. We're doing a pretty good job with our recruitment. We're at about 95% capacity right now with our master's level counselors. But yeah, that's a big thing. And so they are giving more money to the schools. We're going to hopefully have some conversations with them. Maybe we can help each other and provide additional support.
Well, I was going to say that. Now, you have an agency that deals with the whole county and Sandlot County for community mental health, but you don't necessarily spend time inside schools.
We do.
Oh, you do?
We do. We just started that, though, in the last couple of years, because we receive funding through, I've talked about the CCBHC.
Yeah.
So with that special funding, that we're a certified community behavioral health clinic, and with that funding, the overall goal is to improve the overall health and well-being of your community.
Of everybody.
So one of the things we said we want to do is have mental health counselors in the schools if kids just need to talk, want to do some groups, different things like that, without having to have what's referred to like a whole open case, a whole case record on these kids. We don't do that in the schools. We talk with them if they need to talk about things. So we have a full-time social worker at Marysville and Yale and part-time at KPAC. And then we have school nurses at the same levels in those 3 schools. We wanted to expand that, but now we did just hear that I believe that there's some additional funding now through RESO is going to be coming through. So we're going to talk with them and ask, because we don't want to duplicate services, but right now it's almost like you can't do too much in that area.
Yeah, and there's a need for it everywhere, but can you supply the right people at the right place,
Right.
at the right time?
Right.
So, lots of stuff. Okay, let's talk about schools. Every year for how many years now? Is it the 19th annual high school art contest? What's that all about?
Well, every year we have a theme, and our theme is the power of possibility for the upcoming year. And then we kind of write what our theme means, and we get it out to all the high schools, and we ask them to give us some artwork that promotes our theme or represents our theme. And so, we have some good prizes, and I think you have it on the screen. So they're cash prizes.
Cash. We like that.
Yeah.
High school kids like that as well as adults.
Heck yeah. And so, anyways, so there will be like a first, second, third, but then an overall best in show that will be used for our marketing for the whole year. So there'll be billboards. We use it on the annual report, our annual meeting invitations, a lot of different things throughout the year. And the reason we do it is it's part of our anti-stigma initiatives. We're hoping that if kids take the time to learn more about mental health, because you know that they're doing some level of research, or if they let us in to talk about it, we're talking about mental health and hopefully trying to normalize it so that it's okay, because we hope that, I hope in my lifetime, going for mental health treatment would be the same as going because you have the cold or the flu and you need to go to the doctors. So it's just getting a checkup, getting a tune-up, getting taken care of, whatever. You have something going on and you need a little support. So hopefully, so that's why we do it. And then we'll pick that winner in after the new year. The deadline I can't remember for
February 25th.
Perfect. And then the middle school level, we do a writing contest. So we have a fiction, nonfiction, and poetry. 3 categories, again, the cash prizes, and again, it's based on our theme. That's where you can for sure tell that kids Google stuff, because some of the things are written, you can tell they got it right off of Google, which it's accurate stuff, so it's good, they're learning. Sometimes it's not applied exactly right in the story, but that's okay, because they're learning, and that's what we want. And so there have been some really good writing things, and the winner is always published in our annual report, and same for the winning artwork. I said is the big banner of it.
And I want to remind you that you guys have awarded St. Clair High School a number of first places over the years for the art contest.
Yeah, and East China School District both have also, not just the art, but the middle school writing contest at many times. And I can't remember all the winners of the bookmark contest, but that's from kindergarten through 5th grade. We do the bookmark contest, and we just use the theme Be Kind, because sometimes our themes are a little harder to understand at that level.
Yeah.
But the biggest thing we want kids to think about and talk about is just being kind to other kids.
Yeah.
Kids, if they have differences, be kind to them. And we kind of talked about that, because in elementary school, kids are usually pretty nice to each other, lower elementary.
Until they get to middle school.
Yeah, middle school, they can be brutal. High school, they can be mean and bullying, but sometimes they just start ignoring kids that have differences or disabilities or whatever. We want that to change. And in some schools we see great examples of that changing in different areas, and some of the great things schools are doing. But yeah, so those are those contests.
You had a busy couple months with everything going on, and you got a holiday break coming up, hopefully for you and your family. And we wish you the best.
Thank you, and we want, on behalf of everybody at St. Clair County Community Mental Health, we want to wish you and your viewers a very happy holiday season,
Thank you.
Of course, a happy, healthy, prosperous new year. Hopefully, COVID-free.
Yep. So again, Deb and I talked about depression, and don't let that get you down over this holiday season. Pick up the phone, call St. Clair County Community Mental Health. If you need just somebody to talk to, they'll be there all through the holidays. I would assume there'll be somebody on the phones. So.
24/7, and also our mobile crisis unit is also, obviously, they're always available 24/7.
Okay. So thanks for watching this edition of the Focus program. We thank you very much for tuning in. And as I said at the top of the show, Merry Christmas, and we'll see you right after the first of the year.